Mimi, where Mimi? Mimi, batshela bambe kancane.
We are civil society. Here's the problem. Thank you so much, comrades. I started part. Come on.
Phambili nge-civil society, phambili. Phambili nge-civil society, phambili. Ngicela sisukumeke sonke samukele uDeputy President. Engena phakathi kwethu ngiyacela sehlise umoya, sehlise ukukhuluma and welcome the Deputy President of South Africa, Ubaba Paul Mashatile. Ngicela simshayele izandla as he walks in. Awisade ngicane kangaka ninjani kanti KwaZulu-Natal? Oh mama bapho mama bakikizo mama bakikizo mama. Apha makhwela siza makhwela kushayela oh mama balilizele bo. Siyabonga kakhulu. Sizocela ke singahlala phansi. Igama lami nguNomagugu wakasimelane. Ngizoba uco-program director wethu namhlanje. Ngibambisene nobaba uPatrick Mdletshe owu-chairperson we-civil society kwi-province yaKwaZulu-Natal. Siyacela ikhona indawo esethendeni. Nalaba abale muva abangene ngaphakathi bathole indawo yokuhlala so that izokwazi ukuthi siqale umcimbi wethu. Ngizocela ke siqale uhlelo lwethu nge-national anthem. Okusho ukuthi sizosukuma sonke sikhumule izigqoko kubantu besilisa. Thina sonke abanye sibeke izandla emaceleni ukuze sikwazi ukucula iculo lesizwe ngoba iculo lesizwe siwumthandazo. Can we then start our program with singing the national anthem so that we are able to start the process officially? Can we have the national anthem, please? Umakuthandazwa kuyathulwa. Thank you. Can we have the national anthem? Abame abakhipha amanzi ingane zime lapha emuva intombi zizongena kahle uma sesiqedile ukucula iculo lesizwe. Siyalicela ke iculo lesizwe bafowethu. Diplom fano edidite fanon sie woron sie vergebes van die grasse an voltier sounds they call to come together and united we shall stand. Let us live and strive for freedom in South Africa, our land. Well done. You deserve a huge round of applause. Deputy President, we were waiting for our DJ to give us a national anthem. So when that wasn't working, the people of this region decided to take over. Siyabonga kakhulu anishayeleni izandla. Namhlanje usuku olukhulu kabi, usuku lapho esizogubha khona i-World AIDS Day, usuku olugujwa umhlaba wonke. It's a day where we are commemorating the World AIDS Day, which is one of the biggest and most important dates in our health calendar. This is a very solemn and significant day as we remember those who succumbed to the fight against AIDS and are no longer with us. At the same time, it's a time to reflect and celebrate the many strides that have been made in improving access to care and treatment, and also to identify the existing gaps and where we need to improve. Okusho ukuthi lolu suku esihlangene ngalo ke usuku olubaluleke kakhulu ngoba lusinika ithuba lokuthi sibuke ukuthi sesihambe safika phi ngomsebenzi, sikhumbule labo abashiya emhlabeni ebese siya appreciate kulabo abasekhona Si-appreciate kuma-partners esisebenza nawo ukuze sibambisane kulolu dabi lokulwa nengculazi. Siyabonga kakhulu-ke, ngizocela u-district mayor azosamukela, kodwa before esamukela u-district mayor sicela omama basitulele lapha base-stage bathe nje bafuna ukusipha ingoma eyodwa bese siyabadedela-ke. District mayor uzusondele eduze kwethu, ukhansela uShandu. Khansela Shandu. Alright. Asingeneni sithuleke kodwa so that sikwazi ukuthi siqale kahle uhlelo lwethu. Ayibo akulilizelwa yini kule ndawo? Bapho mama bale ndawo. Mic for one. Asibashayeleni izandla, siyabonga bo. Sicela ke ukuthi ukhansela uShandu eze azokhuluma nathi asamukele. We call on Councillor TP Shandu, who's the district mayor, to give us the welcoming remarks.
Thank you very much, Program Director, and also the MEC for Health here in KwaZulu-Natal, Ms. Nomakuku. Similane. Greetings as well, with especially to His Excellency, the Deputy President of the Republic of South Africa, Ubabu Paul Mashatile. Greetings as well to Her Excellency, Mrs. Mashatile, the spouse of the DP and the patron of the Global Alliance South Africa. Greetings to the Premier of KwaZulu-Natal, Mrs. Nomusa Dube Nube. Greetings to the Minister for Health, Dr. Joe Patla. Greetings as well to other ministers who are present here. Sibingelele ko deputy ministers as well abakhona lana ngaphakathi. Sibingelele nako MEC abakhona lana ngaphakathi. Greetings as well to uchairperson waSANAC Civil Society, Mr. Steve Letike. Greetings as well to all traditional leadership ondaba ezitha nenduna namakhosi abakhona ngaphakathi. Sibingelele ko mayor abakhona ngaphakathi. Nabasuka outside the districts. I think here we saw as well the mayor Ubaba Kaunda from eThekwini Metro, umayor Baba Mqadi wasoGwini kanye nosomlomo bonke no deputy mayor abavela ngaphandle. Greetings as well to all the local mayors and speakers here in our districts. Greetings as well to the DG leading all the government officials. Greetings to ladies and gentlemen. Sanibonani. Ninjani. Angithatha leli thuba leli sibonge futhi sanamukele nonke la kwiLembe district municipality la khona siza khona isigubho noma sizo celebrate or commemorate iWorld AIDS Day, and this is intensify noma kuzoqinisa impi yokulwa kanye neHIV kanye neAIDS. Let me take this opportunity mhlambe ngibonge with my gratitude on behalf of the family of municipalities of iLembe to play host to 2023 World AIDS Day celebration, aptly themed Let's Communities Lead. As a district, we are confident that the event will translate into more awareness about igciwane lengculaza noma isandulela ngculaza, and will embolden our collective efforts to do away with the stigmatization of HIV people and ultimately curb the spread of this pandemic. This also provides opportunity for us as grassroots level in local government to focus in advancing actions that will end AIDS as public health threats, address issues of stigmatization and raise awareness about the importance of screening, testing, treatment, retention, and prevention, and also highlight the national strategic plan on HIV and AIDS. This day will help us to take stock of the progress that has been made in tackling AIDS and HIV, and give us an opportunity as well to see the progress in tackling HIV, and also will remind us as well of the commitment and the responsibility that we took, that we are going to protect everyone, and especially those living with HIV and those affected as well with HIV and AIDS. Program Director, as a district, we commend the national government commitments to the fight against the epidemic. As we speak, our country boasting as one of the largest antiviral rollout programs in the world. I think the sad truth is that many a time when we talk about HIV and AIDS, the tendency is to downplay the role played by the People's Democratic Government has played in saving the lives of our beloved ones from HIV and AIDS. Today, the People's Government has made away with the notion that being HIV is equivalent to a death penalty. It's not something that should be taken for granted. Program Director, with those few words, befisa mhlambe ukunamukela nonke la ngaphansi kwesifunda seLembe, and feel free, we can take off mhlambe ama blazers ethu. Feel free. Thank you very much.
Thank you very much to the mayor of iLembe. Ngicela senze kanjeni. Sanibona. Sanibona. All right. Ngicela ke ngoba ngithi niyazi ukuthi sinama visitor namhlanje. Akithi yakwazi lokho. Asingenzi ke into ezokwenza ukuthi bahambe nathi, niyayibona leyo nto. Angithi niyazi umuntu umehamba nawe uma bekuvakashele kusho ukuthi kusuke usungayiphathanga kahle. Siyacela nakukhona okhulumayo simnike ithuba akhulume simuzwe. Ngiyabonga kakhulu indlela enlalele ngayo ke yilokho esicelayo. Ngicela ke ekwenza ama acknowledgements abantu esinabo namhlanje. With us we have the Deputy President of the country, aphinde abe uDeputy President of the African National Congress, ngesiyeke leyo siyabingelela mongameli. Uphinde abe uchair weSANAC. Uzothola ithuba lokuthi introduce kahle uma esezokhuluma nathi. We also have Ms. Steve Letsike, who is the co-chair of SANAC, also a member of the National Executive Council leadership. Siyabingelela. We have Dr. Joe Patla Ogungongoshe, Minister of Health in South Africa. Siyabingelela Tau. Ubaba uPhatla uyafana nathi nani uneyithakazelo. Sithi abantu baseLimpopo president abanazi ithakazelo. Ubaba uPhatla ke sesiyazi ukuthi esakhe uTawu, so sesikhona. Sibingelela Deputy Minister esinabo sinobaba uZizi kodwa no uMinister kuqala. Ubaba uZizi kodwa uMinister ka Sports, Arts and Culture. Angimbona our leadership. Sibe no Deputy Minister waka Health ubaba uSibongiseni Dlomo, ngicabanga ukuthi useza ne program yakade behamba nabo because there was a walk. Sino Deputy Minister waka Justice and Correctional Services, Inkosi uphathekile Holomisa. Useku program. All right. Ukhona kodwa ke. Sibe no Deputy Minister for Women, Youth and Persons with Disabilities, umama uNokuzola Tolashe. Kodwa ke uphinde abe umongameli womama eSouth Africa weANC Women's League. Mongameli. Uma simbingelela kuma umongameli asisho njalo womama sithini? Malibongwe. Igama lamakhosikazi. Nazog. We have Dr. Bridget, who is the ambassador of the US and the delegates. You're welcome, sir. We have Dr. Kalua, who is the head of World Health Organization. Dr. Kalua is always with us. I saw him. Oh, there he is. Welcome, Doc. We have Ms. Eva Kiwango, UNAIDS Country Director. We have Ms. Christine Muhangi from UNICEF. Oh, they're still across. Then we have MECs, members of the Executive Council. Ngizocela abasukume nje bonke kanye kanye abakhona, abanye are still part of the program. I saw MECs Thole Muloyi, MEC Nkonyeni. I know MEC Nkosi is also still part of the program. Sizoba acknowledge again as they come along. And bashayela izandlo MEC esihleli nabo we. Nizoba nenkinga ngoba bazohamba abasivakashela. Sibe no mayor. Sino mayor waseThekwini, umayor wogu, ngicela niphakamisa izandla lapha enikhona. Ugu district, umayor weLembe simbonile. I've not seen any other mayor, kodwa we have local mayors. Naba sebeyangibuka. Omeya bonke bale district bakhona siyababingelela siyabonga. We have members of the provincial legislature who are with us. Siyabonga kakhulu for being part of our program. We have Dr. Xulu, who is the CEO of SANAC, Dr. Sandile Buthelezi, who is the Director General of the Department of Health, Dr. Fikile Ndlovu, the acting DG of the province, Dr. Sandile Shabalala, who is leading members from the Department of Health in the province, all civil society leaders, senior officials, sanibonani. Ngishilo ke nangqala ukuthi I am co-chairing the program no baba uPatrick Mdletshe ozobe nasengiqeda ukubiza lo ngimbizayo ebese yathatha over iprogram ngoba sizobe siloku sishintshana. Ngizocela ke udadewethu uMiss Busisiwe Mqadi, who is who's going to give us a message from the sector of people living with HIV to come and talk to us. Where is Miss Mkati? Okay. Sicela uze ngapha ke dadewethu. Niyamazi uDumi Mkokstad? Hayi ngathi animazi. Niyamazi? Ngempela. Aya nginiboni ngathi nabantu abamaziyo ngendlela eniphendula ngayo. Niyamthanda kodwa? Niyafisa nje akasondele eduze kwethu. Oh, ngisazocabanga ke kuzoya ngokuthi niyiphatha kanjani. All right, sicela uMiss Mkati ke over to you man.
Sanibonani. Sanibonani. Niyaphila. Nami ngiyaphila. Igama lami ngubusisiwe Mkati. Ongaziwa ngoneli. Ubusisiwe Mkati intokazi yala KwaZulu-Natal. Osephile negciwane kusuka ngo-2001. Ngithunyiwe la ngithunywe isector ka people living with HIV. Ithi angiqale ngibingelele ku Deputy President. Ngiphinde ngibingelele ku Minister of Health ubaba uPhatha. Ngiphinde ngibingelele uPremier wethu kwaZulu-Natal ngithi alibongwe. Ngiphinde ngibingelele uSteve Litsike uchairperson wethu we-Civil Society on a SANAC level. Ngibingelele usihlalo wethu ka-Civil Society KwaZulu-Natal ubaba uMdletshe. Ngibingelele u-MEC wethu waka-Health umama uNomagugu Simelane usaxoxa kodwa somnana. Bese siyabonga i-HIV sector nationally ithi iyabonga kuhulumeni wethu ngokuthi i-treatment sesiyitholile sinabantu aba more than 5 million who are on treatment. So njengoba sibonga nje bese sithi siyisector sicela ukuthi zonke insuku sitreatwe like i-World AIDS Day. Ukuthi kwenziwe sure ukuthi aba negative bahlala be negative through i-availability ka PrEP nema condoms. Bese kuthi aba positive bese beya initiate ku treatment through i-care and support ne counseling proper. Okunye sicela ukuthi aba ku treatment thina ke seku treatment sicela ukuthola ama pills enyanga ezintathu 3 months. Okunye sicela uhulumeni wethu ukuthi asenzele kanje. Asicelele ukuthi thina esimise i-appointment ekliniki ngingabuyiselwa emuva ngihlala imini yonke ngoba lokho kuzokwenza ukuthi ngibaleke ngingasaphindi. That's why ubona ukuthi kunama laws to follow up amangaka ngoba thina siyisector sithi noma sesibalandile ozakwethu sibabekile lapha ya endaweni yethu yokulanda imishanguzo baphinde bayofaka egcineni kulayini. Asiceli lokho. Bese okugcina ke simcela kona uDeputy President nobaba uMinister waka-Health sicela ukuthi asicelele uMinister waka-Finance ukuthi akayeke phela ukwehlisa ibudget yaka-Health ngoba leyo idala ukuthi imfuno zethu kuma facilities agcine zingatholakali ngoba ibudget yehlile abakwazi ukufeza idingo zethu. Egameni le-HIV sector nationally, provincially, district and local level amandla.
Ngicela sinikezele ihlombe. Siyabonga busisiwe Mkati. Nisekhona? Sanibonani. Nomungayvala. Nomungayivula. Nomungayvala. Ayvala nomungayivula. Wokulele kuwe mntanami. Wokulele kuwe mntanami. Wokulele kuwe mntanami. Anoma ungayivala. Ayivala. Wokulele kuwe mntanami. Wokulele kuwe mntanami. Awuyibambeke lapho sengibona ithi nikhona. Iphela i-commemoration lena asizanga nje ukuthi sizolala. Kuningi ke okuthe kwakhulunywa. Part of the things that were articulated by the PLHIV sector, they were stressing around the issues of making sure that they are given a supply of 3 months of treatment, which I think that is very, very fundamental. And also the issues of adherence and making sure that people are not being chased away when they defaulted on their treatment. But anyway, we do have such programs. Siyabonga kakhulu kwi-PLHIV sector. Imfishane. Imfishane. No, asiqhubekeni-ke igama lami nguPatrick kaMdletshe. I-program yethu sizothi ukuyibamba siyidedele. Sizocela i-statement of support from South African Financial Local Government and Association. Ubaba uBheki Stofile, President of iSALGA. Siyakucela mongameli. Phepha ukudla mina uzulale ngoxolo. Ake nibambe lapho ke niyabuya.
Mphathi Nkqubo, sekela mongameli welizwe lakuwethu kumhlaba uhlangene, ndunankulu yephondo and oyisa kuba nguceba eminyakeni yakhe yangaphambili, mphathiswa wezempilo elizwe lakwethu, abaphathiswa ngokwahlukana abakhona apha, omeya, ndibonile umeya waseThekwini nabanye omeya ngokubanzi apha kweli phondo lase KwaZulu-Natal, umeya we-district walapha lo usenze ukuthi sibe lapha, abantwana begazi, traditional leaders, osomashishini, u-CEO we-SANEC, i-officials ezikhona apha, nabantu onondaba abakhona. Siyajabula South African Local Government Association ukuza apha ukuzokunikana ngenkxaso kulo msebenzi omkhulu kangaka wenziwa uburhulumente wabantu belizwe lakwethu, lokuthi ingxaki abajongene nazo urhulumente uzithathele kuye, usebenzisane nabantu ukwenzela ukuthi ingxaki abantu abajongene nazo urhulumente udile nazo. Le program iphansi kwesihloko esithi it is important to let communities to lead. And the program enhle ke kakhulu ukuthi singomasipala kuba ithi nxa uthi communities must lead, ithetha ukuthi i-corporations ne-coordination of activities between omasipala, i-community, amasebe orhulumente, kumaphondo nakundlunkulu. Kakhulu ukwalisana nalento sijongene nayo i-HIV ne-TB kunye nezifo esithi sizifumane ngokwabelana ngesondo. Kubalulekile ukuthi singabantu belizwe lakwethu ukuze sikwazi ukuphumelela oldabi, sibambisane, sisebenzisane sonke kwenzele ukuthi sibheke phambili kuba indlela esayifumana ngayo inkululeko kwilizwe lakwethu yayikukubambisana kwabantu belizwe, benza isiqinisekiso sokuba baya egqibeleni bafumane inkululeko enamhlanje esiyicelebratayo singabantu baseMzantsi Afrika. Nathi ukuze sikwazi ukuphumelela kwelidabi le-HIV and AIDS ne-TB, masibambisane, sisebenzisane singabantu bezwe lakwethu ukuthi silwe nalobhubhane sijongene nayo. Sekela Mongameli, kuhle ukuthi kuthi singomasipala kakhulu kule district isikhokhele umeya wale district usikhokhele ukuthi kubekho an active council apha kule district ikwazi ukuphefumlelana nabantu bakuthi. Siyayazi ke lo msebenzi le district wenzayo nezinye idistrict zomasipala ngokubanzi kwilizwe lakwethu ezijongene nazo zimsebenzi okujonga nokuzisa uphuhliso phakathi kwabantu bakuthi kwenzele ukuthi kubekho impilo engcono. Siyayibulela ke iDepartment yezempilo yalapha kweliphondo nakwisizwe ngokubanzi esikhokhelwe nguDr ngokwakhe ukuthi ukhuthaze ukuthi ukuze siphile ngendlela eyiyo sakuphila ngosike sisebenzisane sibambisane, ngeke siphile singabambisananga sonke. Osomashishini, abahlali, omasipala nobuhulumende ngokubanzi kubalekile ukuthi sibambisane kwenzele ukuthi sijongane nale challenge sinayo phambi kwethu. Ndinqwenela ukutsho mphathi nkqubo ukuthi ubuhulumende bethu bungathi buphumelele ukuba sinoyenza lento ngendlela eyiyo yokubambisana ngokuba sisazi ukuthi imeko yemali, ndimvile umama ebethetha apha ukuthi umphathiso wezemali kubalekile ukuthi ayibone imbaluleko yokuinvesta kwi-health, kuba ukuinvesta kwi-health kuthi kwi-local government ithetha ukuthi ku-improve i-revenue base kamasipala ne-ability yokuthi abantu bakwazi ukubhatala, kuba abantu bazabe bephila bekwazi ukubhatala i-services abazifumanayo kubuhulumende bethu. Yiyo lento sikhuthazayo ukuthi kubalekile ukuthi siphile impilo eyiyo, impilo esithatha esibhekisa phambili. Yiyo lento le council ilidwa ngusekela Mongameli noComrade Steve ibalekile umsebenzi wayo ukuthi usiqoqoshe sonke sisebenzisane sonke ukwenzele ukuthi sibheke phambili nenkqubo yabantu bakwethu, kuba abantu bakwethu bajonge kuthi ukuze bafumane impilo engcono. Nathi ke sibubuhulumende basemakhaya size apha uzokuthi sekela Mongameli nakule council sibubuhulumende basemakhaya siyazinikezela sithi olugxadu nulithathileyo lokudibanisa thina sonke, nathi sizimisele ukusebenzisana nani kwenzele siguqule impilo yabantu bakuthi, kwenzele abantu bakuthi ikamva labo liqaqambe, kwenzele bakwazi ekugqibeleni bafumane i-services kumasipala, bakwazi ukubhatala i-services zabo. Sithi ngalo mazwi siyabulela.
Siyabulela kakhulu ukubaba uStofile. Ngicela simnikezeni ihlombe. Kukudla mina uzulale ngoxolo. Hawulale ngoxolo. Kukudla mina uzulale ngoxolo wena. Hawulale. Wakudala uzabala. Anizwa. Wakudala uzabala. Hayibo. Kukudla hawulale. Awushaya ngizwa. Kukudla mina hawulale ngoxolo wena. Hawu. Kukudla mina hawulale ngoxolo wena. Iphela HIV sathi angizwa. Sekudala uzabala. Wakudala uzabala. Hayi angizwa. Kukudla hawula nazo ke zami. Kukudla mina hawulale ngoxolo wena. Hawulale. Kukudlamini hawulale nguqulu wena. Owakudala uzabala. Owakudala uzabala. Yo! Hawulale. Owakudala uzabala. Owakudala uzabala. Ha! Amandla! Amandla! Viva PLHIV sector, viva! Qina mntu ophila nesandulela ngculazi, qina! Matla! Matla! Aruna! Aruna! Matla! Matla! Matimba! Ayina! Matimba! All the power! All the power! Awuhlale phansi ubambe umthetho. Awuhlale phansi ubambe umthetho. Asubambeni lo mthetho. These days actually remind me of the old days where in South Africa we remain ignorant. Mam Kuku died because of our own ignorance and fear. But I'm happy to say today South Africa is doing much better compared than before, where we used to see people dying like flies. So we overturned that particular picture, but I'm not inviting complacency to say we are doing well. We are still in a fight. UNAIDS have done well then to rally us together, then to say, let's put the 1990 targets to end AIDS in our lifetime, which I hope we will do. There are a lot of efforts to contribute towards that. Let me call my next speaker, the statement of support from Labour, Mr. Pet Mpela from Kosatu. Leadership was ngaphambi. Hamandla, hamandla ngawethu webafazi. Angnezo. Hamandla, hamandla webafazi. Mandla ngoba kudala, kudala nisebenzela madoda kwanele. Ngoba kudala, kudala nisebenzela madoda kwanele. Umnotho, umnotho webafazi. Angizwa bafazi, azangizwa. Umnotho, umnotho webafazi. Amandla, amandla webafazi. Nizoxoshwa mina ekhaya, thulani manje. Asiyekele inkokheli.
Amandla. Amandla. Long live the spirit of the workers, long live. Qina, 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 qina msebenzi, qina. Phambili ngomzabalazi wabasebenzi phambili. Shinga mshangi shinga. Wathinta abafazi. Wathinta umbokoto. Igama lamakhosikazi. Uzabalaza, zabalaza, zabalaza. Uzabalaza, 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 uzabalaza. Amandla, amandla. Thank you, Program Director. the Deputy President of the Republic of South Africa, His Excellency and Honorable Paul Mashati agreed. The Honorable Minister of Health, Dr. Cho Basha, agreed you as well. The Premier of KZN agreed you as well. The Chair of SANAC, Ms. Steve Lisike, agreed to. The MEC of Health, Umama Unamakuku, the Honorable, I greet you, ma'am. All the ministers and deputy ministers, I greet you. The mayors and the district mayor, members of the diplomatic corps, colleagues, comrades, community members, and all protocol observed. We as organized labor, we feel privileged and humbled to also share a message of support with you. We all agree that despite the massive effort that we have taken to reduce the pandemic, it is still rampant. And the theme of today's, it is important, it is crucial to let the communities lead. And we as labor also agree that labor issues are community issues, and community issues are labor issues. On that note as well, as labor,
Amandla bafowethu sicelile ukuthi when we have a speaker ikhuluma sicela silinike ithuba kuhloniphana nje lokho ngoba bayasihlonipha nathi siyacela ukuthi sibanikeze leyo nhlonipho. Siyacela nakhona okhulumayo eceleni kwakho mbambe nje abambe umuntu okhuluma yaza aqede. Siyabonga.
Thank you. Amandla. Ayibamba umthetho. As organized labor, we have an important role to play as part of the communities to ensure that our members are encouraged to test, and also we ensure awareness about that, and if found to be positive, to also encourage our members to take treatment without default. To also continue to disseminate information to communities about HIV. And through our members, who are healthcare workers and educators, as well as social workers, to educate our communities and form partnerships with them in an effort to eradicate the pandemic. To also ensure that workplaces are accessible to communities, as well as to to ensure that there is no stigmatization and victimization of our members as well as of those communities, and to ensure that we are courteous and don't display negative attitudes towards our communities, because we believe that collectively we can defeat the pandemic. And through programs and campaigns to educate our members who are servicing communities, not to introduce their own illegal and unlawful cut-off times, especially in clinics, to say we're no more taking patients at 2 or at 3. So as organized labor, we are against that. It's unlawful, it's illegal, but we make sure that we conscientize and make our members aware that as part of communities, we should treat our communities with care and courteously as well. So, and also more important, to ensure that the records of our members are filed meticulously. But it doesn't end there. It is important that together with our government and through social dialogue, to ensure that records are stored digitally so that they don't get lost. And that is what we are busy with. And we also thank our government as well, our leaders, that gradually that is being introduced, because it is very, very important that records are safe. Also, we support the decriminalization of sex work as labor. To also defend and protect our members amongst uncaring employers, but also negotiate better conditions for our members for issues like employee wellness and assistance programs. To also encourage men's forums to be involved in the solution to the problems. And through social dialogue forums to negotiate that the shortage of staff is addressed so that our communities can be serviced. Because also what we believe in is that we should also ensure that we invest in our youth, because you capture the youth and you gain the future. And in closing, we say empower communities and enrich the nation, but also ensure that community leadership is enriched, and then that way we arrest the future. Lead community, lead. Lead community, lead. Forward with community leadership, forward. Amandla. Amandla. Yeah, just to rectify something, I am the president of the National Council of Trade Unions and not of COSATU, but we are organized labor, expert in pillar. Thank you so much. Mandla.
Cela simnikezeni ihlombe. Uxanduva lwabantu luxanduva labasebenzi. If abantu bengasebenzi asizukwazi ukuthi siqhube kahle ama program kahle ngendlela. Ukuba khona kokudla then ube khona ne treatment then izinto zizohambisana. Siyabonga kakhulu Pet ubizo wami ke lo kodwa enwalshaf labalifishane. Ngicela ukuthi ngibize ichoir His Mercy ukuthi ke besondele ngaphambili benikeze into ethe uxokama His Mercy Gospel Choir bengene nje ngicela abanikezeni indawo laphana bethatha istage angazi noma basebeseduzeni ngifuna ukuthi ngiphinde ngibize ilana umama uHumile Mashatile the patron of Global Ireland South Africa emva kwale choir then ibona bazoza la ngaphambili bezosinikeza umbiko ukuthi how far what are the outcomes of their meeting that they had this morning ye dialogue sizobacela nabo ukuthi bebe besondele eduze so that we move a little bit quicker. His Mercy ngicela nibazinikeze nihlombe. So it's me against them. I guess bonke bazomhlula yini.
One, two, and two. Who am I to deserve the love you've given me? Always been by my side and watching over me. I am grateful, oh so grateful. Made me strong when I was weak. Oh Lord, you are worthy to be praised. Who am I to deserve the love you've given me? Always been by my side and watching over me. Oh, so grateful, made me strong when I was weak. Oh Lord, you are worthy to be praised. All my life I've always wondered
why I always have this hunger.
But to you I surrender all to thee. Like an empty cup you fill me.
Where would I be?
Where would I be?
What would I have been
if it wasn't for your grace, oh God, and your mercy that saved me? Who am I to deserve the love you've given me? Always been by my side and watching over me. I am grateful, oh so grateful. Make me strong when I was weak. Oh Lord, worthy to be praised. Oh Lord, worthy to be praised. I lift my voice to the heavens, bursting out with worship, singing songs of victory, of glory be to thee. Oh,
oh, glory,
oh,
oh,
simnikaze nihlombe. I ingathithi bayangihlula, I rest my case. I'm not going to take this challenge on. Sibonge kakhulu sesijoinile umama uMashatile sizocela ukuthi eze ngaphambili ekwazi ukuthi ezosinikeza that feedback, but also babili ke la kunominenhle Thabet angimboni mhlambe mase eduze sondele because sizomnikeza naye futhi u5 minutes mama Mashatile. Cela simnikaze nihlombe while esethe.
Deputy President, His Excellency, Mr. Shibokoso Carlos Mashatile, Program Director, SENEC Co-Chairperson and Chairperson of the SENEC Civil Society Forum, Ms. Steve Betzige, Deputy Chairperson of the SENEC Private Sector Forum, Dr. Chifofazo Hopane, Minister of Health, Ministers and Deputy Ministers present, Premier Nomusa Dube Ngube, United Nations present, Mr. Nelson Mufa, the United States Ambassador of South Africa, Dr. Ruben Brigati, and the rest of the esteemed United States government delegation, representatives of COSATU, Mr. Pat Mpela, SENEC CEO, Dr. Tembisile Kuno, honored guest, ladies and gentlemen, good afternoon. As we commemorate World AIDS Day today, I'm honored to stand before you today as patron of the Global Alliance South Africa. In October this year, I made a commitment to partner with stakeholders here to be one of those who champion the cause of eradicating AIDS in children by 2030. As a stakeholder and advocate for the well-being of children, I submit to the common purpose and aspirations to transform the lives of children and to ensure that no child suffers from the preventable and treatable diseases in our lifetime. When launching the Say Yes for Children campaign in 2001, President Mandela emphasized that any country or society which does not take care of its children is no nation at all. It is these words that inspire the efforts of the Global Alliance to end AIDS in children by 2030. This year's World AIDS Day commemoration, under the theme of Let Communities Lead, is an invitation for the community to partner in eradicating HIV and most importantly, protecting our children from this virus. The prioritizing of children in this year's program reminded me of the late Nkosi Johnson, a young activist who was the first winner of the International Children's Peace Prize, who fought the fights to end the stigma and discrimination against HIV. I believe his work and passion still serve as motivation for an HIV-free future. The voices of children stemming from this morning's dialogue were loud and clear, that we must create a South Africa that protects our children and safeguards their future. The children reminded us that regardless of their background or circumstances, they deserve a future that is no longer burdened by HIV and other preventable, treatable diseases. It is in their innocent voices that as leaders and parents, we must be inspired to ensure that the children are protected and nurtured to reach their full potential. A widened gap in HIV response between children and adults has forced the global community to refocus its efforts on ensuring that no child living with HIV is left behind, on care, treatments, This resulted in the announcement of the Global Alliance for the End of AIDS in Children by 2030. The initiative was announced in Montreal, Canada in 2021, followed by the official launch in Tanzania in February 2023. The Global Alliance brings together local, national, regional stakeholders, comprised of United Nations agencies, civil society, government, and international partners, taking ownership of the initiative. South Africa is part of the 12 African countries in phase 1 of the alliance, aimed at preventing new age infection in children and ensuring that all HIV-positive children have access to life-saving treatments. Despite the complexities associated with HIV and AIDS, leveraging availabilities, medical advancements, technologies, innovation, and access to life-saving treatments and tools make it possible to end AIDS in children. Therefore, success in delivering on this promise to children requires more than just medical interventions, but also calls for collaboration efforts with communities to address all social determinants that render children vulnerable. Our children have made a call today to parents and the community to act decisively and protect them. We have the responsibility to eradicate HIV/AIDS in children in South Africa, and also protect the rights of the children. We should also, as a nation, ensure that we eliminate poverty by providing necessary nutrition to children, especially those on treatments. The Global Alliance in South Africa can help the country meet its 95 HIV and TB child-focused targets. Together, let us ensure that we deliver on the promise to end AIDS in children by 2030. I thank you.
Cela simnikeze nihlombe. Siyabonga kakhulu umlayezo umama. Ngaphandle kwabantwana bethu bengathola usizo lwilona angeke sesikwazi ukuthi sinqobe ingculazi kanye nengculazi uqobo. We are as a South Africa remain committed ke mawubheka izinto esizenza kuthiwa zingane, but ke ezinye zezinto lezi ezihluphayo where you find ukuthi baningi kakhulu abanye abantwana that are still lost to follow up. As a civil society KwaZulu-Natal and also national, we remain committed then also ukwenza sure ukuthi we prioritize abantwana and we make sure ukuthi they are part and parcel of our response. Ngicela ukuthi ngibize from a message of support on behalf of children, uMinenhle Thabethe, uPhumontuza, Minenhle, twakwane ngebhasi elingale, but hilelo bhasi, bhasi langa kithi lale balokuthi amadoda awayifuni le ngoma manje awayifuni. Hilelo bhasi langa kithi lale noma asibambeke ngoba ngifuna beshade labantwana. Woza Minenhle, cela simnikeze nihlombe.
Sanibonani, igama lami uNkosingiphile Cele, ngiqhamuka khona la eMandeni, ngisuka kwi-organization yabawasamukela home based care HIV and AIDS. Mina ngifunda khona la uthukela, ngihlala ku Ward 7 eDark City. Njengoba ngila phambi kwenu ngizokhuluma ngama rights abantwana and ukubaleka kwabo. Oqala ngizoqala ngibingelele all protocols that are available in this room and all people that are coming from different departments. Umntwana ubalekile ngoba he or she is the one that is going to carry out the nation. Uyena ozobhekelela isizwe, uyena ozokhulisa isizwe. Futhi njengoba khona abantu abasekhundleni ezinkulu namhlanje yingoba khona abantwana. Njengoba sibona khona odokotela, omengameli nabo bonke laba bakhona abaphakeme yingoba khona ingane. Ingane ibalekile. So njengoba sizingane siyadinga ukuthi abazali besikhulise ngendlela kuzoba ngeyethu ukuthi mase sikhulile singasuki kuyona njengoba nesilenkosi lisho. Njengoba ngilana ke mina ke ngizosho ukuthi ingane ibalekile. Siyacela singabatwana abazali besinakekele besikhulise kahle ningasihlumezi kodwa nisivikele. Njengoba khona ngisho malume emakhaya besihlukumeza obhuti kanye nobaba futhi ngabe ibona abasivikelayo. Siyacela futhi abazali njengoba kuyibona abasikhulisayo kube yibona futhi ababa responsible nathi soba responsible ngama lotunja ethu ama responsibility ethu ukuthi siwafeze njengengane. Ingane kubalekile ukuthi ukhule ngaphansi komndeni onesisekelo nothando. Ngoba siyasibona emgwaqeni ingane ehlala emgwaqeni ezinye sizingena edamizweni. Lokho kudala ukuthi umntwana usuke engatholanga uthando lwanele. Umntwana omunye azabaleka xole ngisho ukubaleka ekhaya enxa ukuthini akathola uthando futhi akasupportwa ngendlela asizwa ngayo. Ngiyacela ukuthi ke futhi abazali njengoba besikhulisa njengoba kune teenage pregnancy ekuyiyona high rate kangaka ne-unemployment kanye nama-socio-economic issues amanye ahlukene adalwa yiyo i-teenage pregnancy cause the time umntwana ezala ingane nayo usuke ingane then bese eyandisa ama-responsibilities akhe ingane okungayona into e-right. Bese umntwana mase ezalile ingane uzoyilaxaza eshiye nogogo. Ugogo athi naye akayanayo imali yokuyondla ngoba naye senenkinga zakhe njengoba naye ephila njengegwenete ayidalayo. Bese kuba nobubhesweni eningi ngenxa yemthelelo emincane eyenzekalayo uthi umntwana usuke ungamfundisanga naleto ukuthi umntwana usuke umgrounde kakhulu ukuthi angakwazi ngisho nokuhamba. Bese mase semi-university ayenze into ebengamele ngabe yayenza ngenxa ukuthini usebona sephatha umhlaba oright ibona ngathi sekhuleka kakhulu ngendlela ukuthi angenza noma yini. Bese ke thinteka lapho umntwana uthi uzoyenza izinto engasile ethole sengena edamizweni ebona ngathi impilo emnandi. Kanti umntwana emngase umkhuthaze into enazenzayo umxwayise ngezinto ezimbi nezinhle futhi uhlale naye phansi umkhombise umtshele ngempilo ukuthi impilo injani ngaphandle uzokulalela futhi naye enze njengoba indlela umfundise ngayo. Ngiyabonga.
Thank you so much for that message. She is clearly indicating how children themselves want to be treated as human beings, how we should be able to engage with them, talk to them as people who are able to understand, not talk down to children. Siyabonga kakhulu, I think we are certainly taking that message. Can I then quickly, because isikhathi sethu sesiyashaya, we want to be quite fast on the program, call on the ambassador, Ruben Bridgetti, to come and give us a statement of support from the development partners. He is the US ambassador to the Republic of South Africa. Over to you, sir.
Sanibonani. His Excellency Deputy President of the Republic of South Africa, Paul Mashatile. To the Second Lady of the Republic of South Africa, Madam Mashatile. Honorable Minister of Health, Dr. Joe Pachla. Honorable Ministers, Premiers, MECs. To the SADC co-chair, traditional leaders, to the people of the Republic of South Africa and all protocols observed. I am deeply honored. I am deeply honored to join you today for World AIDS Day. And I am proud of the strong partnership between the American and South African people to jointly address the challenges created by the HIV epidemic. Today is not just a day of remembrance. It is also a day of action and of commitment. This year's theme, Let Communities Lead, centers our shared journey focused on eliminating HIV as a public health threat by the year 2030. Over the last 20 years, the US government, through the President's Emergency Plan for AIDS Relief, or PEPFAR, has collaborated with the South African government and the South African people to overcome the devastating impact of HIV. Together, we have not only saved lives, but we have also transformed communities. We have reshaped the global response to HIV, and we have contributed to greater economic prosperity, both here in South Africa and abroad. You know, there was a time, as was mentioned earlier, when people were afraid to openly talk about their HIV status, or to even associate or even touch somebody with HIV. And things have changed. Now, people encourage each other to know their status, and to access prevention, or to start treatment if they are diagnosed with HIV. And they encourage each other to stay on that treatment in order to suppress the virus in their systems. Our shared commitment to end HIV epidemic as a public health threat by 2030 stands as a beacon of hope and of determination. We must work together to find those living with HIV, to help them get on treatment, and to ensure that they feel empowered to continue to take their medication in order to lower their viral load. Science has proven to us that when the viral load is low enough, it cannot be transmitted. Undetectable means untransmittable. You means you. U equals U has profound implications. It empowers individuals living with HIV to make informed decisions about their relationships and sexual health without fear of transmitting the virus to their partners. U equals U also has the potential to reduce HIV-related stigma and discrimination. And finally, U equals U enables all of us to embrace our shared prosperity. Our health partnership has helped to mitigate the economic impact that HIV could have made here on South Africa. And we are committed to increasing this great nation's prosperity by investing in the health of its people. Let's take this opportunity on this World AIDS Day to rekindle the spirit of unity and determination. Let us stand together, driven by the shared goal of eradicating HIV as a public health threat by 2030. And through our collective efforts, we know that we can turn this vision into a reality, ensuring a world where all people, irrespective of their backgrounds, will have access to live free from HIV and AIDS and live lives full of prosperity. Thank you very much.
Thank you very much, Ambassador, for those words of support. Indeed, they are appreciated. Can we then quickly call on Dr. Tsuhufatso Khupane to come and give us a message of support from the business. She's the SANEC Private Sector Forum Deputy Chairperson. Over to you, ma'am.
Honorable Deputy President of the country and the Chair of SANEC, Co-Chair, Ms. Steve Litzeke, the Premier of KZN and the Chair of the Provincial AIDS Council, Minister of Health, Deputy Minister of Health, the Mayor of Ilembe District, MEC, HODs and MPLs and our various development partners, civil society forum leaders, the CEO of SANEC, and fellow ladies and gentlemen, Dumelang. As we gather here on World AIDS Day 2023, I'm honored to represent the SANEC private sector this year under the theme, Let Communities Lead. We align to both the vision of the UNAIDS and the resonant motto of the South African AIDS Council Civil Society Forum, Communities Matter. Refa Kabatu. We are here because of the people. In our collective endeavor to combat AIDS, with a specific focus on ending AIDS in children by 2030, we recognize the indispensable role of communities. They are not merely recipients of health interventions, but are leaders and partners in this crucial fight. Our approach is rooted in collaboration, empowerment, and respect for the voices and needs of communities. Over the years, we have seen successful collaborations between private sector companies and community-based partners, enhancing HIV and TB service reach at community level. The Global Alliance has outlined a clear action plan demanding worldwide leadership, political commitment, and resources. The private sector is uniquely positioned to contribute to each one of these areas. Our resources, our expertise, and our networks are essential in supporting national government and community efforts to address inequalities and program financial gaps. We advocate for the support of action at national, provincial, and district level. This involves strategic resource mobilization to achieve program objectives and ensuring equitable distribution and effective utilization of these resources. Our role also includes stimulating innovation. The private sector's role in creating and implementing a mutual accountability framework is vital. We must hold ourselves, our partners, and our leaders accountable to all the commitments. This accountability goes beyond financial contribution. It includes ethical responsibility to ensure that every child and community that has the means to fight this epidemic. As we focus on children and community-led approaches, we are reminded of the urgency of our mission. Children are the most vulnerable yet resilient members of our society. By focusing on them, we invest in a future free of AIDS. We are not just fighting a disease, we are nurturing a generation. As a leader in the SANEC private sector, I'm proud to highlight our role in these efforts through our most recent collaboration with SABCOA, DBS, and Afrocentric Group. This specific partnership in the community is a shining example of what can be achieved when we work together, drawing on collective strength to deliver holistic and comprehensive health solutions. We have managed to screen 25,198 people in the community, achieving an extraordinary balance of 50% of men and 50% of women. Our involvement in these initiatives are driven by a firm belief that private sector has a crucial role to play in public and community health. To this end, the Afrocentric CEO has pledged further support for private sector initiatives outlined above. We bring to the table not just resources, but our network. We invite both big and small private sector entities in the health and social arena to join the SANEC PSF in its endeavor to coordinate and elevate the private sector contribution to community well-being objectives. Together, as government, civil society, and the private sector, we can champion this change. Together, we can ensure that every voice is heard, every life is valued, every community is strengthened. In conclusion, the private sector is committed to standing shoulder to shoulder with every stakeholder in this fight. We are dedicated to listening and to learning from the communities we serve. We are committed to being part of a solution that is sustainable, equitable, and respectful to the dignity of each and every individual affected by this epidemic. Together, with this unwavering resolve, we are united in purpose to end AIDS in children. Together, we can ensure that communities do not just survive, but they thrive. I thank you.
Cela simnikeze nihlombo uDr. Ngiyamxoxela ke uDr. lana ukuthi iLembe is one of those districts that does not have necessary support. So I'm asking for a pledge. Uthi hayi angikhulume no Steve uyazi. Angazi ke Steve ukuthi wazini ngoba sise KZN ngizocela sulusheshise nje lolu daba kuze ungathiwa yasala nami. Also Ambassador, we also understand, we also are grateful with the support of PEPFAR in KZN. We see and we know the impact of the programs that they are implementing in KZN. However, I'm still asking and requesting for the extension to KZN, particularly to iLembe district, because really, Mayor is sitting Lama resources. So the Mayor is agreeing with me to say, please, PEPFAR must also relook into its resources. Not also alone, I'm not leaving out UNAIDS. We are really asking for AMA pledges today. Already the minister, when we met with him yesterday, he promised that he will make sure that all our complaints and everything that the community was complaining about yesterday, he will see into it, including not cutting off the 1 million rand. Sifuna obo minister abasebenzayo abapromise izinto zenzeka hayi ke leyo is done. Ngicela ukubiza uSteve Letsika, the chairperson of civil society in SANEC, and also the co-chairperson with SANAC and the chairperson of civil society. She's the woman, no woman, no cry. She's the leader. She's the woman. She's the leader. Uzawalaza, uzawalaza, zawalaza, uzawalaza. Steve.
Amandla. Amandla. Viva SANEC, viva. Viva SANEC, viva! Viva people living with HIV, viva! Viva traditional leaders, viva! Viva health professionals, viva! Viva sex workers, viva! Viva women, viva! Viva young people, viva! Viva children, viva! Viva THP, viva! Viva research sector, viva! Viva communities, viva communities, viva communities. Viva Deputy President, viva. Viva UNAIDS, viva. Viva WHO, viva. Viva Children's Sector, viva. Viva Department of Health, viva. Viva Men's Sector, viva. Viva LGBTI, viva. Viva MECs, viva. Viva, 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 umphakathi wase KwaZulu-Natal. All protocol observed. I don't want to waste. Let me call and say, viva persons with disability, viva. Viva people with disability, viva. Today is the 1st of December. This month, from the 3rd of November to the 3rd of December, we have been observing the Disability Month. So it's very important to actually focus on persons with disability. I wanted to do a special calling as it's done. But Deputy President, let me thank the two program directors This program is facilitated with so much discipline. Ngibonge MEC wethu, MEC Nomagugu Simelane, and the provincial co-chair, Ubaba Patrick Ndleje. Deputy President and all dignitaries that are here, I am sending all greetings on behalf of Civil Society Forum. Communities lead now. Let me begin by acknowledging the work and this work that is done by civil society everywhere. But this work is not done by civil society alone. It's the work done together with our government, with private sector, and partners who support South Africa. We are grateful for all the support by development partners who graciously support this country to prosper. This week, we have seen policy in action where various sectors, partners, collaborated in leading activities up to today. The entire Ilembe district and other parts of the country have had a hive of activities at the core principle of leaving no one behind. We have seen social mobilization for the official program largely driven by communities. Since the 20th of November 2023, over 6,000 people were mobilized in this community. And we saw engagements, we saw educational activities in the 14 sites of Ilembe district. This was mostly led by people living with the HIV sector, together with all other sectors. And these leadership of activities involved national sector leaders, provincial sector leaders, district sector leaders, as well as local sector leaders. We saw the delegations moving around the corridors and the households and the halls of Ilembe. And I want to note that the civil society effort leading to today, we saw also the disability sector, which developed an awareness checklist for healthcare workers. And what we've seen as part of commemoration of the disability sectors, it opened sources that can be adaptable in facilities. We saw that the doors and the corridors can accommodate persons with disability. So Deputy Minister of Women, Youth and Persons with Disability, we want to really request a continuation of support in collaborating with persons with disability sector so that we do more even beyond the KwaZulu-Natal community. So we are gracefully thankful for that effort. Deputy President, I want to say that some of the key messages were delivered. People with disability have called for access to facilities. That all facilities must be accessible, it must never be negotiated. And that people with disability must have reasonable accommodation. There are booklets that are being distributed here. We want to see the Braille material. We also want to see simplified infographics on site for persons to assist people with specific disabilities. But also those who use dogs as a guide must also be accommodated on sites. Siyayazi ukuthi niyayisaba izinja, but these ones are the ones that assist our people and they provide guidance. So we are requesting that let our facilities minister and Deputy Minister of Health accommodate persons with disability who use dogs as guide. And lastly, on the issue of disability, we request that capacity of staff in facilities must be strengthened. There are people who are there, who are deaf, also who are blind, and sometimes the capacity of staff is limited to assist accordingly. Now let me move also to highlight some of the key activities done. The women's sector has been hard at work with advocacy for social justice and also issues of exclusion and ill treatment. As we are commemorating 16 days of activism, we must end violence now. Phansi nge-violence, phansi. Phansi nge-violence, phansi. We want to really request the partnership. I know Deputy President is a champion. He believes in women's empowerment. I've heard and I've seen his work. And we are really grateful, Deputy President, on that. But during this 16 days of activism, which Tina as women, we regard this as 365 days. Because every day a woman gets violated, a child gets violated, an LGBTI person gets violated, and we want it to end. We want prevention approaches. Let's not only put effort on response. We spend 45 billion on response. If we turn this money and put it on prevention, we can do better. Now the sector has pushed to really work with communities namadoda as well. We want men to help us in communities in ending toxic masculinity. Communities must be safe. Communities must be safe for men, women, children, LGBTI persons, persons with disability, and everybody in their diversity. Now, civil society is at work. Siyakuba. Asimanga, siyasebenza. Deputy President, you have also witnessed the work just about 2 weeks ago. You were in Limpopo, having partnered with the men's sector on the Takuani Rime. That work around building a better man, it's a movement we want to see being strengthened. The faith sector, I'm not only just saying Christians, the entire faith sector must be up in arms in making sure the churches, the mosques, and all the gatherings where people of faith gather must also be part of the HIV response. Distinguished guests, I want to say that at national and local level, we cannot do this work without putting people first. For us to turn the tide around in the HIV response, we must make sure that communities, people are at the center. The schools in our community must be safe. And not only do they have to become safe for our children, the schools must be protected as infrastructure. Let us not ban schools when we are angry as umphakathi. Let's protect our infrastructure so that young people can go to school, lead a better life, make the correct and informed decisions about their life, and that will help us to reduce HIV infection and all other social ills. And we request that the partnership between communities and our government in protecting the infrastructures, let that be strengthened in what we do. Deputy President, I want to say this is the message also to Minister of Health. The National Health Insurance is a very important piece for our country. We want universal health coverage now. We want to commend our government And we want to commend our representatives in the legislature. Let national health insurance be passed. We want it now. It's very important because civil society has contributed in that NHI agenda. And we have contributed to add on community engagements included even in the Presidential Health Compact. NHI is one of the tools to assist us in making sure that persons, all South Africans and people in South Africa have got access to health. Now, colleagues, I don't want to end my message without talking about the work led by people living with HIV. We are where we are because of the leadership provided by people living with HIV. You will recall and you will reflect in the 40 years, almost 40 years of our response, where we come from as a country and where we are now. And when we got that message from a representative of persons living with HIV, they said, we are over 5 million with people living with HIV having access to treatment. Let's give a round of applause for this work, important work, that is supported by our government and our development partners that invest on treatment. But we want to also say, this treatment that we've seen in HIV must be affordable. The same way we want TB treatment to also be affordable. So we are requesting our government on the issues of affordability. Let's engage all these pharmaceutical companies to reduce the cost of treatment. We want our people to live longer, but to have access. Now I can see Umdleje is next to me. As I come closer to ending my message. Deputy President, we've launched the National Strategic Plan. You led us. That NSP has prioritized specific populations. Key and vulnerable. Sex workers. LGBTI. Children. Men who have sex with men. Transgender. The inmates, as well as persons with disability and women and young people between the ages of 15 to 24. Deputy President, the NSP called for the human rights-centered approach, and it's driven by all stakeholders. We need to move faster because 2030 is around the corner. We only have less than 6 years to deliver the 2030 agenda. We have to make sure we end HIV as the public health threat. The same way we've joined the call of ending AIDS in children by 2030. The last 2 points I want to raise, and I'm going to sit down. Deputy President, South Africa must spend money now in order to save later. Our government must spend money now. So the message to Minister of Finance, spend money now to have a better economy and a better population. The message to development partners, PEPFAR, Ambassador is here. We call on the US government to reauthorize PEPFAR and invest in South Africa. Our message to Global Fund, we have contributed to the replenishment of Global Fund. That money must come and must be spent on the grounds. So the primary recipients must not become gatekeepers, spend the money at the people's level. The last point is to say this administration of our government is coming to an end. in a couple of months' time. We are going into the next administration. I want to call South Africans, those who are in the public health, in communities, everywhere you are, register to vote. It's your right. It's important to make sure that the government is restored and there's discipline in reaching out to the people. Amandla.
Hayi bese ngicabanga ngivele ngemiyele eqhubeke ngoba ushinto ezibalekile kakhulu manje. Part of those things in that and we have to make sure ukuthi suspend imali ayingakhathwa, let's increase the budget. So I increase the budget. So we need NHI now. We need NHI. We need NHI. Hasina lova. Niyazi lo ngoma? Hasina lova. Hasina lova. Thina njenge-civil society asinavalo. Hulente siyenzayo. Hulente siyenzayo. Hulente siyenzayo. Aha. Hulente siyenzayo. Hulente siyenzayo. Hulente siyenzayo. Awema hulente siyenzayo. Hatu valo dololo. Oh valo dololo. Hulente siyenzayo. Luva hawema. Hawuvume moya wa. Hawuvume moya wa. Hawuvume moya wa. Aibo. Iyavuka lento manje. Hawuvume moya wa. Hawuvume moya wa. Hawuvume moya wa. Hawema. Ngiyanibamba ngizoze nivukele umoya. I want to call upon Miss Eva from UNAIDS, UNAIDS country director. UNAIDS ke iyenza ingqomo ezinkulu nezibalekile yathi let the community lead. Asisho masithi let community lead, it's because we understand very well ukuthi whatever that we've been doing for the past 2 decades is not what's going to take us to end AIDS by 2030. Meaning that we need innovation, we need new strategies and tactics, we need everything. We need you as a community to stand up and be accounted to what I can do on an individual and a personal level on ending this AIDS in our lifetime. Miss Eva, cala simnike ihlombe.
Hello. Your Excellency, Deputy President of South Africa and Chairperson of the South African National AIDS Council, Honorable Minister of Health, and other ministers here present, Deputy Ministers, the Premier of KwaZulu-Natal Province, MECs, the spouse of the Deputy President and the patron of the Global Alliance, Civil Society Foreign Chairperson and Co-Chair of SANAC, Honorable Executive Mayors, the Ambassador of the United States in South Africa, my fellow UN representatives, the SANAC CEO, Civil Society Forum representatives, all distinguished participants, especially the children. Sanibonani. On behalf of the resident coordinator and the UN family in South Africa and beyond, I am grateful to be here today with you, all distinguished participants, activists, and the hospitable community of Mandeni to honor those who have lost their lives to AIDS. This important commemoration also provides us with a collective opportunity to take stock of the AIDS response and to firmly recommit to ending AIDS by 2030. The United Nations Secretary General said in his statement on this day that we can and we must end AIDS as a public health threat by 2030. Reaching this goal means heeding this year's theme, let communities lead. Vumela mpagati uole. That is why the UN stands in solidarity with the 7.8 million people living with HIV in South Africa. South Africa has an encouraging and strong story to tell in its response to the HIV pandemic. And this story begins with powerful community leadership. We know that the path to end AIDS has been forged by communities, and countries that succeed in ending AIDS are those that have communities leading the way. It is important to recognize the role of civil society in South Africa in the late 90s and 2000s. Community advocacy from the streets to the courtrooms to parliament secured groundbreaking changes in HIV policy in this country. This fearless spirit, courage, and determination has been the driving force behind South Africa's progress. It has catalyzed political and financial commitment from government, and today, South Africa funds 70% of its HIV response domestically. A commitment unmatched in sub-Saharan Africa. We must ring-fence our HIV conditional grant. We equally commend the leadership and continued commitment of the government to ensure South Africa remains on the trajectory to end the AIDS epidemic by 2030, as per the National Development Plan. The way to achieve this goal is the bold agenda set out in the People's National Strategic Plan for HIV, TB, and STIs that was launched in March by our Deputy President. Your Excellency, it is clear that the path to ending AIDS runs through and with communities if they get the support they need from governments and partners. We must place communities at the center. We must remove barriers to community leadership and ensure the space for local civil society groups to take forward their vital work. We know that the path to ending AIDS is through communities. Communities do not lack capacity. In fact, communities have shown that they are ready, willing, and able to lead the way. We are confident that with the launch of the South Africa chapter of the Global Alliance to End AIDS in Children by 2030, today, under the patronage of the Second Lady, we can close the treatment gap for children so they can lead the full and prosperous lives they deserve. Children are the heart of communities, and as is often said in Africa, it takes a village to raise a child. Today, we need the village more than ever to accompany children to testing, to talk to them about their HIV status without fear and shame, and to encourage them to adhere to their treatment.
We want to use this World AIDS Day as a moment to honor communities, call on respecting and resourcing communities, because that is how we will end AIDS. Your Excellency and distinguished participants, the United Nations remains committed to accompanying the government and communities at large in ending AIDS as a public health threat. Vumela mpagati uhole. I thank you.
Thank you very much, Miss Eva Kiwango. Umyalezo wakhe ulula nje uthi vumela umphakathi uhole. Angithi siuzwile. Uthini? Kunjalo uhulumeni ke kufuna abambisane ne civil society, abambisane nawo wonke ama stakeholders ukuze umphakathi uhole indlela ofisa ukulashwa ngayo. Siyabonga kakhulu ke ngoba niyiphathe kahle, ngithe ngisazocabanga ukuthi uDumi Mkokstad ngiyambiza yini noma ngimenze njani. Nibona ngathi niyiphathe kanjani? Nibona ngathi niyiphathe kahle? Nisho? Alright, ngizobona kulokho kokugcina ngizocela undunankulu kuba uyena ozokhuluma nathi. Ebese ke uma seniyiphathe kahle kwangempela, bese niyathembisa futhi noma sekukhuluma uDeputy President nizoyiphatha kahle. So bese ngimbiza uDumi emva ka Premier, kodwa kwamanje sicela uPremier azosipha ama remarks.
Malibongwe. Malibongwe. Igama lamakhosikazi. Phambili ne civil society phambili. Phambili nohulumeni onakekelayo phambili. Siyabonga kubaphathi bohlelo MEC Simelane no co-chair we-KZN Council on AIDS, Mr. Mdletshe, Your Excellency, Deputy President of the Republic of South Africa, Mr. Mashatile. We also wish to acknowledge Mrs. Mashatile in the house, who's also the patron. We also wish to acknowledge Steve, the co-chair of SENEC, the Minister of Health, Dr. Phahla, Minister Zizikodwa, Minister of Sports, Arts and Culture, Deputy Ministers that are present, women, youth, and persons with disabilities, the Ambassador of the United States of America. We also wish to acknowledge Dr. Kalua of the UN World Health Organization, Ms. Eva Kiwango, Ms. Mohangi from UNICEF, MECs, MEC Nkonyeni, MEC Sithole Moloi, MEC Nkosi. Siyafisa ukubingelela Inkosi yesizwe ephinde ebe usihlalo wendlu yobuholi bomdabu la kwiLembe District, Inkosi uBhengu kanye namakhosi asendlunkulu wonke akhona, umeya waseMandeni, umeya waseLembe kanye nazo zonke izimeya ezikhona, o deputy mayor, o speaker nama councillors. Sibingelele all senior managers, senior HODs, CEOs of all the institutions, civil society. Kodwa ngokubaluleke kakhulu sibingelele umphakathi esingawo la sanibona. Sanibona bo. Siyajabula kakhulu kuba ingxenye yalomsebenzi obaluleke kangaka namhlanje ngaphansi koholo laka Deputy President, Deputy President Mashatile. Siyabonga kakhulu kuSANAC ukuthi ubone kubalekile ukuthi uze lapha KwaZulu-Natal
ukuzokwenza lo msebenzi obaluleke kangaka wesizwe. Ukuba khona ke kwalo msebenzi where we are looking at the work that we have done in the province of KwaZulu-Natal, asiziqhenyi Deputy President nomphakathi wakithi ukuthi KZN is still has the highest HIV prevalence in South Africa. Our province experiences the burden of sexually transmitted infections, which can be seen in the high teenage pregnancy rates based on the delivery for the age group of 10 to 19 years, a high burden of sexual assaults. And I must say that ayikho into esiphatha kabuhlungu njengo-MEC uSimelane nomsebenzi wakhe awenzayo emnyangweni wezempilo uma sifika ezibhedlela zethu sibone abantwana abaneminyaka e11 e12 beyoteta. Ubone ukuthi lo muntu lo olele la akazi nokuthi kwenzakalani nalo muntu amlethela emhlabeni akamthandi ngoba ubengamdingi. The combination of all these things reflect on the extent of the interventions that we are making, Deputy President and the co-chair of SANAC. We have really worked hard with the civil society in the province of KwaZulu-Natal, and it is instructive that 2023 is a significant year in the country's fight against the HIV, TB, and sexually transmitted infections, as it marks the first year for the National Strategic Plan for HIV, TB, and STIs of 2023 to 2028. Deputy President, siyafisa ukubika ukuthi mukhulu kakhulu umsebenzi owenziwa la KwaZulu-Natal. Muhle futhi ngoba izibalo ziyakhombisa ukuthi izibalo eziqala ngo-April ku June, July, zikhombisa ukuthi KwaZulu-Natal is doing well with the first 95 of knowing about your HIV status. We are not happy ukuthi the other two categories covering the people who are on ARVs and the suppression of the viral load asenzi kahle kulabo 95 abalandelayo. And in this regard, we are going to be working tirelessly on the UNAIDS 95 goals. All our 11 districts have been able ukuthi bakwazi ukufika kulo 95 wokuqala wonke ama district wethu awu 11. And esenza kahle kakhulu ekutheni abantu bateste and are indeed are able ukuthi abantu baqale ukuthatha amaphilisi wabo and bakwazi ukuthi baqhubeke nokuthatha amaphilisi wabo. The Department of Health is leading this campaign with agility, with the passion that we see abasebenzi abaholwa ngumama uSimelane baze banesiqubulo esithi Operation Phuthuma Buyani. Phambili no Operation Phuthuma Buyani phambili. Ngoba sithi abantu bakithi mamabuye bazothatha izinto zabo. Ngoba kusho ukuthi uma ngabe usuzibona ngathi sowuqinile kusho ukuthi ungasabuya ukuzothatha izinto zakho. We also have, Deputy President, even in this area where we are, we do have vending machines where people can go and access their treatment in those vending machines. That is why we are happy that all the initiatives that have been taken by Umnyango Wetu, Department of Health, Woguti, we talk to the clinics, we talk to the churches, the community halls, any other facilities as khona eduzane lapha abantu bakwaziyo ukuthi bayolanda khona treatment yabo. The campaigns are taking place at the community level to strengthen the U equals U, which is the undetectable equal to untransmittable message. And this is the message that is largely driven by the civil society in our communities, and to which we are very grateful. Civil society esinayo ekwaziyo ukuthi bambisane ngesandla nohulumeni ekusebenzeleni umphakathi wethu. We are aware, Honorable Deputy President, that this is not a KwaZulu-Natal problem, but it is a national problem. And we are pleased that the spouse of the Deputy President has launched the Global Alliance aimed at ending the phenomenon of children with AIDS, which is driven by the United Nations level. And we are ready to support the campaign and the program that is driven by Mrs. Mashatile as the patron. We are also focusing on the children with TB and HIV to ensure that they finish their treatment until baze bakwazi ukuthi baphile kahle. Siyaziqhenya ke ngokuthi akukhona nje kuphela ukuthi zonke lezi zinto esizenzayo sizenza sodwa, kodwa sizenza ngokubambisana okukhulu nomphakathi wethu. Kodwa futhi siyajabula ukuthi iKZN legislature ikwazile ukulauncha iTB caucus eyalaunchwa eCoxted by uSpeaker of the legislature, Honorable Boyce, working with the portfolio committee Yagwa Health. We have also not forgotten to focus on the TB, because TB remains the main worst killer of the people of KwaZulu-Natal. At least 70% of the co-infected with TB and HIV are people that will die unless we focus on both of these equally with vigor at the same time and not at different times. Siyafisa ke Deputy President sesiphetha ukusho ukuthi as a province ya KwaZulu-Natal, despite all these challenges, our view is that the war against the HIV and AIDS will be won. Sizoyinqoba le mpi le. It can, however, only be won when every member of the society plays their part. And the common goal for us is to accelerate the progress towards meeting the UNAIDS 95 targets, so that by December 2030, 95% of people living with HIV know their status, and 95% of those infected are also on sustained treatment, and 95% of those on treatment are virally suppressed. Sithi ke namhlanje njenge KwaZulu-Natal sengathi singaqhubeka nokubambisana okuhle esikubonayo with the civil society yethu. There is a strong emphasis on different community voices, but with one message, a continuous message driving the improvement in meeting the targets and bringing together the greatest number of people to be involved in this fight esibhekene nayo yokunqoba lesi sifo. Masibambisane ukuze sikwazi ukuqeda nya i-HIV ngo-2030. Sithi emphakathini wethu wonke njengoba sila eMandeni sengathi le myalezo enikezelwa la namhlanje ingangaba nje imiyalezo esizoyilalela, kepha kube imiyalezo esizothi noba sibuyela emakhaya sikwazi ukuthi silidlulise lelivangeli lokuthi kubalekile ukuthi sizicheke siqhubeke nokuthatha i-treatment yethu. Siyajabula ke Deputy President ukuthi njengoba sila umnyango wezempilo uhlala ukwenza ke lokhu ukuthi ube nazo izinsiza ezikhona njengoba sila bakhona even abakwazi ukuchecka amehlo, amazinyo, bachecke even screening for cancer and even the male circumcision. Ikhona ayikho into engekho lapha ya ungqongqoshe uhlala enza isiqiniseko. Kukhona ngisho i-X-ray. Ayikho into engekho lapha yana nokuchecka i-BP noma yini ofuna ukuyichecka. Kukhona konke esikujabulelayo ukuthi awukho umcimbi kahulumeni ongabi nawo lama services. Sengathi angabi khona umuntu ozohambe ayibuyele ekhaya angazange akwazi ukuthi achecke. Amandla phambili nokubumbana phambili. Phambili nokusebenza ngokubambisana phambili. Amandla. Ngiyalithanda leculo ubaba uMdletshe aliculayo. Athi kulento esiyenzayo kulento esiyenzayo kulento esiyenzayo
Siyabonga kakhulu kundunankulu. Premier, thank you very much for presenting our response as the province of KwaZulu-Natal. It is indeed the work that we are doing, DP, and we work on it collectively. As you know, we have championed MECs in all the locals, and all the MECs take responsibility. Upremier ke udlulile kancane ku 10 minutes wakhe, Deputy President. Manje upremier umphathi bekungelula ke ukuhlalisa umphathi phansi. I had to stand just a little bit at the back and hope that she looks around and sees that I'm there. Siyabonga kakhulu. Ngicela ke umfowethu uDumi Mkokstad angene asiphe imucu lembili esivumelene ngayo.
Sanibona. Naze nabahle nina. Sanibonani. Sewurathi engahamba ngithi. Sewurathi. Sisho ukuqina. Uthanda ukubingelela kubaphathi bethu wonke egameni kaJesu. Protocol observed ngiyabingelela ngegama kaJesu siyumntwana. Ngaze nganithanda nina.
amazwibela nje lawa udumo usekhona uyabuya uma kuqeda nje umongameli uphezulu kwethu amazwibela nje lawa ngifuna ukunikhombisa ukuthi sabantu abakuthanda kanjani ukujiva la KwaZulu-Natal. Siyabonga kakhulu, ngicela sithathe indawo zethu zokuhlala bese siyacela ukuthi ungqongqoshe wezempilo Minister for Health ubaba udokotela uJoe Phahla ezokhuluma nathi ebese introducela uDeputy President. Minister, please introduce and give us remarks. Thank you.
Sanibonani. Sanibonani. Yabona manje umphathi wohlelo umbeke inkingeni manje. Ukulandela udumi kunzima kakhulu. Ngoba mina angikwazi ukucula. Bengizoqala ngengoma ngicule nami kodwa angiyazi ukucula. Yabonga. I can see Udumi has really inspired us. I could see my friend here, Excellency Ambassador, was already, feeling like somewhere in New York, somewhere in the Baptist Church. No, thank you very much, Siyabonga umphathi wohlelo. This time for me to say a few remarks and usher in our main speaker for today, the chairperson of SANAC, Deputy President Mashatile. Aslalan Bagit, thank you very much. Let me pass my greetings and recognition to our Deputy President and his better half, Mama Shatile, also being our patron for the Global Alliance to End AIDS and HIV in Children, our co-chair, Ms. Steve Litsike, all the ministers, deputy ministers, the premier and MECs, members of legislature who are here, our host, district mayor, thank you very much, Bonga Kakulu, Samgela Wako, Kalin Galum Mkimbi, and all the mayors and councillors who are here, Amakosi Akona, Untudangulu, Usamugela Makosi, Nathi siyabulisa Amakosi Ndabezitha. To also our partners who are here, all of them, from the UN family, from the partners, PEPFAR, Global Fund, and all of them who are here, to the leadership of civil society, people living with HIV, and all other members of the civil society. Umphakathi wala eMandeni sanibonani futhi. Ninjani? Hayi nathi siyaphila. Thank you very much Manqale nje ngibonge uMEC noNtunankulu for hosting us today on this very important day of the World AIDS Day. KwaZulu-Natal ngempela iphambili ngoba na last week DP same time or a little bit earlier than now besila KZN not eMandeni kodwa not iLembe beseThekwini uMayor Kaunda was hosting us samba nomongameli no president sivula isibhedlela esisha esinhle very nice beautiful hospital Pixley Sakaseme Hospital. So KZN yaquba. Angithi niyaquba KZN. Yaquba KZN, yaquba KZN. DP, I can also just mention ushilo premier ukuthi KZN is the most burdened in terms of HIV/AIDS and also TB. I want to repeat what I also mentioned last Friday. KZN siyayinquma nje ngoba siyayinqoma ngoba isizulu sami phela siphuma eLimpopo. I will mix up sometime, I will say wrong things. Siyayinqoma. Yebo ngiyazama yiyona. Yeah, siyayinqoma KZN. Ngoba even though in a burden, the biggest burden HIV is leading the country in terms of how to respond. KZN is leading. Ngoba kulama district asinawo 52 la South Africa. Masbheka nje out of the top 15 in terms of response to HIV and AIDS. KZN ihamba phambili. Out of, if you look at the top 15 out of 52, at least 9 if not 10 of the top are here in KZN. When we talk about the targets, national and international, of reaching 95, starting with 1990, KZN ehamba phambili. So the province, using Sukuma Sake approach, have made sure that what was supposed to be an adversity, it's actually a show of resilience. And so in terms of South Africa being able to defeat HIV and AIDS, we are being led by the province of KZN. So Maktiwa, the theme for today is let communities lead. Ngempela la KZN, under the motto of Sukuma Sake, dala nje KZN sebenzisa le theme yokuthi let communities lead. Government, civil society, all the other sectors, amakosi, religious leaders, communities overall have been leading here in KZN, so we can see that in practice rather than in theory. We know that, as already mentioned by Comrade Steve and other speakers, together, all of us, government, civil society, and all the players, we have made a lot of progress. Together with our support partners, we have made a lot of progress, and that is why a few days ago, about a week ago, when the Human Science Research Council released its report on the survey by the Human Science Research, it showed a lot of progress that indeed were turning the corner in terms of dealing with HIV and AIDS. But at the same time, we know that there are still a lot of challenges. Ushilo Premier Lana, just as an example, teenage pregnancies, and also which go hand in hand with a lot of new infections amongst young people, especially young women and adolescent women and young girls. So we still have those challenges, rise in STIs. So umsebenzi usekhona omkhulu fanele siyenze uyaphambili. So we are saying that notwithstanding all those challenges, we want to use this day today to reinstate our commitment to ending HIV and AIDS, reaching 95 in 2 years' time, but also ending HIV and AIDS as a public health threat by 2030. From the Department of Health, we want to pledge here that we are ready. The DP was there with us, Community Health Center. We've got our frontline workers are working hard. We still have a lot to overcome in terms of some of the tools of work, including just record keeping. So those are some of the things which we must still overcome. And yesterday when we were together with people living with HIV, they did raise some of these issues. And as Comrade Steve Ashile, I did pledge to them that we are going to address all those issues. So indeed we are making progress, but there's still a lot of issues which, as a government, but also working together with all our partners and in SANAC, will be able to overcome. We are not alone in this fight, of course. Just in the African region, we are working together. Just about 3 days ago, we were together in Angola with all the SADC ministers, where we also were able to look at how far we have gone in the fight against HIV and AIDS. And it was encouraging to see that many countries have made a lot of progress. In fact, DP, I know that we have the biggest challenge. But you know, when you sit there and your neighbors, Swatini, Nabo, Lesotho, Lesotho is all inside South Africa. But Lesotho is very, very close to 95, if not already there. Eswatini is already talking about 97. Botswana is already talking about 97. So, of course, they are talking about the smaller populations, all of them of less than 2 million total population. But I think it means we must work harder. But I believe that with all that we have already started, where we are, the fact that we have made a lot of progress in terms of initiating people on treatment, the fact that we have over 5.8 million people already on treatment, starting, if we look just 15 years ago, abantu bakithi ushile bashile ba-comrade lana nabomdleshe ukuthi basibheka nje la sibuya khona lesikhathi kwabulawa oDudu Dlamini, we're still in the dark, and it's not very long ago. So we have made a lot of progress. A few years ago, just over 15 years, even from the government, we're still not committed to making sure that we can make life-saving treatment available. But today, this is no more negotiable. This is something which we are committed, and we must just make sure that we can make the necessary improvement. So, as we conclude the 6th administration, Deputy President, all the leaders assembled here, I want to take this opportunity to thank all the partners who have been working with us, the UN family, PEPFAR, Global Fund, WHO, and all of them for having walked this journey with us up to now. We have gone a long way, but as you know, our founding president, President Mandela, every time you climb a hill, you think you have finished, but as you go down, you see another one. And the next one becomes even more difficult. We are now, in terms of the HSRC, there are just some numbers which you need to reconcile. But in terms of at the national level, we have crossed the 90-90, we are short of the 95-95. There are still some districts which are lagging behind. To push just to go to the top of the hill, that's going to be the more difficult. So I want to urge our partners also to add on, Comrade Steve and others, to say that all our partners, we say, please walk with us to the finishing line. 2030 is not very far. We need that support and commitment to the finish line. I can report here, when I left the PHLIV meeting yesterday, I did mention that I was going to participate in a forum with PEPFAR, with the leadership in Washington. Very successful engagement. We had a number of members of Congress who were also participating in that discussion. And they have pledged to support us in Congress to make sure that PEPFAR will be reauthorized. So we're very optimistic about that with one major partner, which is PEPFAR, that we're going to walk an extra mile. But I want to say to all our other partners within SANAC, the civil society, business, the private sector, labor, and all of us, that indeed, as we conclude the work of the 6th administration in the next 6 months or so, let us make sure that we conclude that on a high note. We must push that by the end of this administration, we are much more closer. In the remaining few months, all the districts, let's make sure that we are much more closer to 95. It can be done, but I also want to say, I know I must be careful here how I put it, otherwise others may say that I'm abusing certain things. But I think it's a reality to say, the future of whether these programs, this progress which we have made is going to continue after the next, into the 7th administration, is in your hands as the society, as the community. Because what happens after the next election is not going to be decided somewhere. It's going to be decided by yourselves and your families, your friends, and all the communities where you come from. So for us to make sure that indeed by 2025 we can reach 95 of coverage and saving more lives, of making sure that by 2030 indeed we can have the possibility of eradication of HIV and AIDS as a public threat. Ushilo umungameli wethu wokuqala uNelson Mandela mayiphume ejele wathi impilo yakhe isezandleni zenu. Nami ngithi namhlanje ngithi ifuture yokuthi sizoyiqeda le AIDS beyond 2024 kusezandleni zenu. It's all in your hands in the next 6 months. So this is a challenge I'm leaving with you. You can throw away that opportunity and take it into something unknown, or you can make sure that it's in safe hands and make sure that we can reach 2030 and make sure that we achieve our targets. Ladies and gentlemen, in this process, we are led by our Deputy President Mashatile. This is his second World AIDS Day. Last year when we did World AIDS Day in Rustenburg, he was still under initiation. But Romanje initiation say pelile, he can't claim to be still learning the ropes. He now has all the ropes. And we can see that no, he's really leading us. Now he must lead us to make sure that Masek Pela let him have a scorecard. So in the short time I was a deputy president, I managed to get closer to 95. But we are quite certain that under his leadership, in the remaining few months of this administration, he will be able to take us to the very close to the greener pasture of indeed eradication of HIV and AIDS as a public health threat. With that, ladies and gentlemen, let me take this opportunity to now invite our Deputy President, a leader in his own right, with a long service in the country, in Gauteng province, many roles. So it's somebody who is tried and tested. Deputy President, the people are here to listen to you. Thank you. Malibongwe Bathinta bafazi zokufa finish and climb. Mangibulise abaphathi bohlelo Minister MEC for Health Gugus Melani, no Provincial Civil Society Chairperson Patrick Mdleje, our gracious host KwaZulu-Natal Premier Nomusa Dube Nube, who is also the chairperson of the Provincial Council on AIDS in KwaZulu-Natal, Minister of Health, Dr. Joe Pahla, Minister of Sports, Arts and Culture, Babuzizi Kotwa, SANAC Chairperson, Co-Chairperson and Chairperson of Civil Society, Ms. Steve Letsike, Deputy Chairperson of SANAC Private Sector Forum, Dr. Khopani, the UN Resident Coordinator, Mr. Nelson Mafu, the Patron of Global Alliance South Africa Chapter, Mrs. Humile Mashatile,
the United States Ambassador to South Africa, Dr. Ruben Brigady, and the rest of the esteemed United States government delegation, representative of COSATU and all organized labor here present, particularly Mr. Pat Mapela, SANAC CEO, Dr. Tembisile Tulu, traditional and religious leaders here present, all the children who have joined us, they are there on the other stage. Sanbonani, our children, Dumelang. Let me also recognize the presence of Deputy Minister for Health and all Deputy Ministers here present. Mangibulisa Makhosi, our traditional leaders, Ndabezit. Greet all our religious leaders present here today, members of the media, ladies and gentlemen, Sanbona, Ninja, Sanbonani Emandi, Niapila. Today we join the world in commemorating World AIDS Day. This day provides us with an opportunity to strengthen our solidarity and unity of purpose in the fight against HIV, to support those living with HIV, and to remember those who succumbed to AIDS-related illnesses. This day also serves as a reflection on the progress made in response to HIV epidemic and raises awareness about the challenges remaining to achieving the goal of ending AIDS by 2030. This day also serves as a reflection on progress made in response to the HIV epidemic. The theme for this year's commemoration is Let Communities Lead. This theme urges all of us as stakeholders and communities to redouble our efforts and invest in community-led interventions and community-centered approaches in responding to the HIV epidemic. This theme also encourages communities to address inequalities such as poverty, discrimination, and inadequate access to services, particularly for vulnerable communities like women, transgender persons, sex workers, persons with disabilities, and particularly children. Communities must actively participate in strategic interventions to combat the stigma, discrimination, and human rights violations affecting individuals infected and affected by HIV/AIDS. History demonstrates that when communities unite, any challenge can be overcome. Our combined strength can help us achieve the goal of eliminating HIV/AIDS and tuberculosis as public health threats. Active civil society participation has been crucial in the HIV response globally and also in our country, leading to significant progress in areas like access to prevention, treatment, care, and support, as well as outreach for vulnerable populations. An additional area that necessitates strong oversight from civil society is the pervasive problem of gender-based violence and femicide, the correlation of which is universally recognized with HIV. In this regard, in the past 2 weeks, I had the opportunity to interact with men during the National Men's Parliament in Limpopo Province on issues related to gender-based violence and femicide. I stand here deeply encouraged by the efforts of the Takuani Reime Men's Movement, which is coordinated by the SANAC's men's sector and has demonstrated commitment to establishing community men's parliaments in every village in our country, townships, suburbs, and communities in South Africa as a whole, thus ensuring a responsive men's movement. This movement seeks to mobilize men and boys to stand up and be counted in the country's efforts against mental health in men, gender-based violence and femicide, new HIV infections, and toxic masculinity, and for men to be drivers for the positive socialization of the boy child. We also, Program Director, recently launched the 16 Days of Activism for No Violence Against Women and Children. We launched this program in Mpumalanga province. As government, we urge communities to work with us in eradicating the scourge of gender-based violence and femicide in our society. We should work together to get rid of patriarchy, economic inequality, insensitive social norms, and harmful cultural practices. The scourge of gender-based violence is detrimental to our efforts towards the achievement of the Global Sustainable Development Goals, as well as to our very own National Development Plan. Fellow South Africans, one of the key build-up activities for this year's World AIDS Day was the launch of the 6th South African National HIV Prevalence, Incidence and Behavioral Survey done by the Human Resource Research Council, as Minister Pasha indicated earlier. According to this survey, there are about 7.8 million people living with HIV in our country, which is a decrease from 14% in 2017 to 12.7% in 2022. Whilst the results clearly show that the prevalence of HIV is declining, there are some worrying patterns regarding the age group between the ages of 25 and 49 years. Amongst females, HIV prevalence was highest in ages 35 to 39 years at about 34.2%, whereas among males, HIV prevalence was highest in ages 45 to 49 years at 27.1%. Furthermore, there is reason for concern about the increased incidence of HIV infection amongst adolescent girls aged 15 to 19, since it is an indication that older men engage in unprotected sexual activities with young girls and young women. We must take extraordinary measures as society to protect our children against immoral predators. We must ensure that children have a safe environment to discuss issues influencing their sexual conduct and the pressures they are under. We must stand with them and educate them about their rights and sexual health. Furthermore, while acknowledging the significant advance in HIV treatment cascade at a broad level, our deepest concern persists regarding the lack of access to treatment by HIV-positive children, young people, and young men. The survey shows that in 2022, among the people aged 15 years and older who were living with HIV in South Africa, 90% of them were aware of their status. 91% of those who were aware of their status were on antiretroviral therapy, and 94% of those on treatment were virally suppressed. We may not have met the 90-90-90 targets in 2020, but we are confident that we will meet the 95-95-95 targets of December 2025 and be well on our way to fulfilling our commitments towards the Agenda 2030. In this regard, we launched the new National Strategic Plan for 2023-2028 earlier in March this year during the World TB Day, which we held in Northwest. This National Strategic Plan places people and communities at the center of our efforts to overcome inequities in the country's response to HIV, TB, and STIs, and to end AIDS. Since the district of King Kejwayo, Ugu, Umkhanyakude, and Umzinyathi were the first districts in the nation to achieve the 90-90-90 targets ahead of the schedule. In this province of KwaZulu-Natal, MEC, we are confident that this is a goal that is attainable. It was in Umkhanyakude where we launched the new cost-effective, client-friendly HIV treatment regimen called TLD, which is one tablet once a day with fewer side effects and highly efficient in achieving viral suppression. Our primary objective as government is to integrate all facets of an individual's healthcare into a unified system, ensuring that everyone consistently gets quality medical care. Another game changer in our progressive treatment literacy efforts is the integration of the U equals U. Undetectable equals untransmittable. This is a concept into our policy framework. It simply means that if a person takes their treatment consistently without fail, they will achieve ongoing viral suppression until the level of the virus, the level that the virus drops to below 50 copies per milliliter. At that point, you are classified as having an undetectable viral load, indicating that you cannot pass the virus on to your sexual partner. However, we advocate for safe sex, since being undetectable will not prevent you from passing on sexually transmitted infection to your partner or having an unplanned pregnancy. As a country, we are struggling with retaining people on treatment. And this is something that we really have to work hard on, which is the second 95. However, U equals U is one of the key interventions that will assist us with treatment, initiation, and retention. It will also encourage people living with HIV to strive for an undetectable viral load status, thus enabling them to enjoy a longer, healthier life by combating stigma and discrimination against people living with HIV. Stigma and prejudice can be as traumatic as the illness itself, leading to partner or family rejection, social marginalization, school expulsion in some respects, denial of medical services, a lack of care and support, and sometimes leading to violence. We encourage our community leaders to engage our communities in order to alter societal attitude and customs, some of which are influenced by our upbringing. We did emphasize this message when we met with traditional leaders and church leaders, and we hope that working together we should be able to succeed, particularly to also deal with this issue of stigma. Fellow South Africans, this year's World Day commemoration revolves around the launch of South African chapter of the Global Alliance to End AIDS in Children by 2030, which is led by the Alliance National Patron, Mrs. Humile Mashatile. As I mentioned earlier, we are concerned with HIV treatment gaps in children. Children living with HIV aged 15 years and below are left behind in the global HIV response when compared to the general population. Globally, only 52% of children who are living with HIV are on life-saving treatment, compared to 76% of the adult population. So we are leaving children behind. This has resulted in children accounting for 15% of AIDS-related deaths on an annual basis, despite the fact that only 4% of the total number of people living with HIV are children. Stigma, discrimination, punitive laws and policies, violence, gender inequalities in Eastern and Southern Africa remain some of the barriers that hinder access to treatment, to care and support for women, girls, and children. Unfortunately, South Africa has the largest population of children living with HIV in the world. And as of June 2023, our treatment coverage for children is alarmingly low, coming at about 67%. These statistics undoubtedly raises concerns and emphasizes the urgent need for increased efforts and resources to guarantee that every child who is HIV positive receives the care and treatment they require. In response to this challenge, and with governments in the lead, UNAIDS has coordinated United Nations agencies, including UNICEF and the World Health Organization, as well as other development partners such as PEPFAR and the Global Fund, together with civil society in the establishment of the Global Alliance to End AIDS in Children by 2030. The proclamation was first made, as alluded earlier, at the 24th International AIDS Conference held in Canada in 2022. South Africa was amongst the first 12 countries to join this alliance. As a South African government, we are determined to fulfill our commitment to end AIDS in children through the following. 1, strengthening case finding amongst HIV-exposed infants and children, scaling up the initiation of the TLD regimen to pregnant and breastfeeding women as per the revised clinical guidelines, strengthening regular retesting of pregnant and breastfeeding mothers, scaling up access to social protection programs, including social grants, nutritional support, and early childhood development for eligible children, adolescents, and women living with HIV, and other priority populations for improved access to HIV treatment and other services. And lastly but not least, addressing gender-based violence and femicide, sexual assault and abuse of infants, children, adolescents, and women, including scaling up advocacy for the enforcement of laws and the administration of justice. In conclusion, program directors, I'm happy to officially announce that the South Africa chapter of the Global Alliance to End AIDS in Children by 2030 is duly launched today. Collectively, we should strive to ensure universal access to treatment, eliminate mother-to-child transmission, and confront prevailing prejudice and discrimination in order to foster a society that accepts and supports all individuals, not some, but all individuals living with HIV, but particularly our children. Together, program directors, we have the power to end the epidemic of HIV and AIDS. Together, not separately, but together, we have the power to end the epidemic of HIV and AIDS. I thank you for your attention. Thank you very much.
Thank you very much, President, Deputy President. As part of the launch, DP, the organizers have requested that the Deputy President and the leadership on the platform, together with the Second Lady, go across to take a picture with the children as part of our launch. So if we can just go there for now.
2. Let's pull the keyboard.
Isibambile.
The child is a gift from God. Mimi.
Mama Konyeni. Ibambe Dume, ibambe. Nako sengibona uzivusela manje uyabona sizogcina sikhale. No, umuntu akabonge ukuthola leli thuba bekumnandi konke kukuhle. Sisazoba nememezelo ukuthi makuphunywa la abantu bazokwenza njani. Abanye bayakuphi, abanye bayakuphi. Ngizocela ukubiza ukhansela uMdlalose ezosenzela i-vote of thanks. Then we'll take it from there. Babu Mdlalose. Simnikeze ithuba.
Ngiyabonga kakhulu umphathi wahlelo. Ngibingelele ku-Deputy President, Ministers, Deputy Ministers, MECs, all protocol observed. Ngiyabonga kakhulu sithi asibonge siwumasipala waseMandeni ukuthi sibe abakhethekile ukuhosta lo mcimbi nokuthi futhi kuqopheka umlando ukuthi kulonjwe namhlanje iprogram by uDeputy President. Siyabonga ke sizwile futhi Deputy President ukuthi program no minister bikhona some 2 weeks ago eThekwini nivula nezibhedlela. Siyababongela omakhelwane bethu labo. Lokho kwenza ukuthi kubonakale intuthuko iya kubantu. Iya futhi kubantu abanhlwembu. Ukwakhelana kwethu ke neTheku la kwi district yeLembe ula eMandeni kuwo wonke lama LM akhona iMandeni kuphele ngenaso isibhedlela ekubeni iMandeni yona ephinde ibe nezimboni ibe nabantu abathababe baningi njoba befikile lapha sekela mongameli bezosupporta this program banethemba lokuthi njoba kade siseThekwini nenza umsebenzi omuhle ngeke nisayithatha ibhano yeKing Shaka ningadlulile la eMandeni nibone ukuthi nenze njani njengomasipala ususele wodwa kwi district ngokungabi naso isibhedlela nokuthi ke futhi enyangeni eziyisithupha ezizayo silaba abantu bala eMandeni asinakho ukwesaba ukuthi inhlangano oyilidayo sekela mongameli kaAfrican National Congress iphinde futhi ukuthi siyituse siyivotele ukuze izoqhubeka nalama programs amahle owaqhubayo. Sitha siqinisekiseke lapho bongqongqosho no MEC bethu la sasikhona ukuthi uhulumeni sekela mongameli uyindoda enkulu engezi kubantu kodwa sibone usekela mongameli sibonge hamba phansi eyofika kwiclinic yethu nabanye ongqongqoshe behamba bebona la senze khona intuthuko uhulumeni waseMandeni uhulumeni siubona ngamehlo siuthinta ngezandla nentuthuko siyibona kanti angeke ke sithi in 6 months time sekela mongameli bese siyakubetray okwethu nje ukuthi siqinisekise ukuthi leli hasho ligibelile liyawina futhi in 6 months angeke singabaze lokho. Sitha sibonge kongqongqoshe abakhona sibonge nakuma MECs asebenzisana nabo naku district mayor wethu siyisithi ke lapha ke sekela mongameli kune ground laphana ogijinjwa kulona amahashi uma eseyowina eGreyville ayaye bese bheka kulomgwaqo okuthiwa uMarriott Road lapho basuka uJuki sebemile begijima njengoba nawe sekela mongameli nethimba lakho sibonge nje ukuthi ugijime lwafika lapha eMandeni angeke ke mongameli bese sithi sesiyowina bese sishintsha uJoki sizobe silimemeza nje ihashi sithi awuqhubeke njalo uhole sekela mongameli uhole lenhlangano emanqolo emasondo African National Congress iqinisekisa ukuthi abantu abahluphekile siyasondela ngoba sifundiswe iyona ukuthi asosondela kubantu abahluphekile ngaso sonke isikhathi le program eze lapha sekela mongameli sithi asibonge kakhulu kuwe lokho okwenzile ukwenza nabo kwabanye bakubona ubuhle bezulu njengoba usuqalile nje lo msebenzi sithi awufeze futhi ngiyaphakamisa nje nami nabantu baseMandeni siyakubona ubuhle bezulu angeke siyishintshe indlela esoletha ngayo intuthuko sithi asibonge nje in general ngiyabonga ngenza ukuthi uyasondela emphathi wahlelo nani nesiphathele kahle neinsimbi nesiphathele kahle ngiyathemba nanoma nizwi nilibona ichibi linyakaza ungayenzi likhuna inhliziyo yakho uthi nabi ngiyathanda ukuyokhonza la khonza khona umongameli siyabonga kakhulu.
That's what happens when you give a politician a mic to do a vote of thanks. No, thank you kakhulu Mayor, we really appreciate. Sizophunya phunya ngoba la first into engifuna ukuyisho ethi we got entertainment, a very packed entertainment kuzoqhubeka uDumi Mkhokstate eqala ngiphethe lapho uNondindwa. Yamazi uNondindwa? Ya, uzohlabela umaskande nizozwa phela. Kukhona laphana ubongo weNxumalo. Uzosinikeza ipoetry, kube khona umthakashana. Uhlaba ingoma ke kumthakashana mubi kakhulu. So okwamanje ngizocela ukuthi sisukumeni sidedele ama dignitaries ethu baphume bese kuba umbiko omunye obalekile la ngaphandle masiphuma sijikela ka right kunokudla laphayana ukudla kwanele kunama marshals abazokwazi ukusincedisa ukudla kwanele for wonke umuntu okhona la asike isidingo sokuphushana wonke umuntu uzonela manje ngakutholanga impela angazi kuba kwenzeke kanjani kofana ngicela umeya ke ngizombuza futhi kodwa ke ukudla kukhona so ngicela ukunikeza our dignitaries sicela uDumi Mkhosi start on the stage ngesijayvo kokugcina leaders of SANEC Sibusisiwe Hall leaders of SANEC Sibusisiwe Hall ila sizoya khona thina abanye siyala attended everything is provided all our mayors siya Sibusisiwe Hall our mayors and MSs and all other officials here Sibusisiwe Hall